Thank you. Our work in West Africa, recognized by this Lasker Bloomberg Award, would not be possible without the selfless determination and dedication of our staff, particularly our national staff from Ebola-affected countries. Through countless acts of courage, more than 4,000 men and women have cared for Ebola patients in West Africa. Alongside some 1,300 international workers, they have fought daily for 18 months. 14 of them tragically lost their lives. It is in their cherished memory that I accept this award today. MSF response, while generating many accolades, ultimately illustrate an appalling systemic failure. There have been 24 Ebola outbreaks since its discovery 40 years ago. Yet, in this latest one, people were literally dying at our feet for lacks of treatments, vaccines, or point-of-care diagnostics. Yes, the world mobilized, but only after a handful of Ebola cases emerged in the West. And rather than initially focusing on the source of the epidemic and attending to the core medical needs of the most affected, measures were enacted to protect borders and trade. The international epidemic response system simply is not working. There are no interventions for a number of regularly occurring epidemics. Measles is today ravaging parts of the Democratic Republic of Congo. It, along with cholera, meningitis, and other vaccine-preventable diseases, claim thousands annually. This is MSF daily field reality. Ebola has only reinforced the fact that global health security cannot be disconnected from individual health security. Global health security requires putting those most at risk at the center of any epidemic response. Enforcing quarantines and imposing travel bans only exacerbate outbreaks. Ebola also exposed a global research and development infrastructure that is unfit for purpose, saving lives. We should be conducting safety studies and agonizing over ethical frameworks during inter-epidemic phases. This would allow fast-track use of experimental drugs and vaccines during an outbreak, and efficiency trials as the epidemic peaks. Yet, all too often, we scramble to act only as an epidemic peters out. We lost critical months during Ebola. We must act upstream of epidemics, not at the tail end. Lives are lost by the failure to manage R&D drivers and timelines. Just as global health security response must be guided by the actual needs of actual patients, so too must biomedical research. The Lasker Awards testify to the tremendous strides made in medical science. Yet, the alarming gaps in R&D on emerging infectious diseases, neglected diseases, even antimicrobial resistance, leave patients facing the greatest disease burdens by the wayside. We can launch satellites into deep space, yet we can't handle a virus, be it Ebola, flu, or SARS. How is this possible today in the 21st century? I am utterly convinced that R&D can be a game changer in preparing for the next epidemic. Innovative solutions, along with radical new thinking, are required. For Ebola, MSF is supporting the creation of a network of biobanks. Roughly 100,000 blood samples collected by a number of foreign laboratories can be used for R&D on Ebola diagnostic, treatment, and vaccine. On the ground, so many have done so much to fill the massive gaps. So many have perished. Their deaths must rally us to act before epidemics or new threats explode. R&D must be redesigned to ensure that medical advances benefit those with the most acute needs. This can in part be achieved with the creation of a global fund for R&D. It is precisely in this domain that you, here today, can make a unique difference. Thank you very much.
We now have a brief video to show from MSF.
Hello, my name is Patrick Tra. I have worked as a national staff with MSF for the past 7 years. Now I am the field coordinator for Ebola viral disease survivor program. We faced many challenges during the Ebola outbreak. MSF has been overwhelmed in caring for Ebola patients. The outbreak was out of control, and MSF had to call on others to respond. Frontline workers were working in difficult conditions and were suffering stigmatization. Some were even evicted from houses by their landlords. I contracted Ebola in October 2014. It was quite a dark moment for me and my family. I cannot forget the sight of 3 MSF colleagues lying stone dead in the patient ward. May their souls, the souls of other numerous frontline workers and other innocent victims rest in peace. Even though the incidence of the outbreak drastically declined, there is still unfinished business we survivors contend with. Ebola-related complications. Survivors continue to face stigmatization in their respective communities. Some are suffering from severe eye complications. Some even have gone blind. Some homes are broken down because the head of the family died from the disease. Or the head survived but has lost a source of livelihood and therefore cannot afford to provide the basic needs for his family. Survivors need access to free health care. We need sustained effort to get to and maintain 0 cases of Ebola. A strong surveillance and response system is necessary. Let us all resolve with one loud shout, say to Ebola, never again.
Frontline staff, to Dr. Liu, thank you for all that you do. And to Mayor Bloomberg, thank you for joining us to give this very important award. Have a great day, everybody. Thank you for joining us for the Lasker Awards.